Coalition for Global Hepatitis Elimination, the UN Group of Friends for Hepatitis Elimination, and the esteemed colleagues from the WHO and esteemed representative for the patient advocacy group, the partners, and all the attendees. And I would like to start with something very positive, just to complete the picture of the UN Group of Friends for Hepatitis Elimination. And I think you are the champion so far, and you deserve it. The second big round of applause, John, for your significant role in this. So I want to tell you a story about the value of such kind of innovative mechanism. Since maybe 4 or 5 years, we started to establish a support program from the Egyptian side to a lot of like-minded countries, those who are suffering from the burden of hepatitis B and C. Unfortunately, we have a lot of struggles and bureaucratic issues with a lot of those countries. And when we established the UN Group of Friends, John started to put the power of diplomacy and trying to make a bridge to use the power of diplomatic missions and the high-level representations from a lot of countries in order to move ahead into the health-related challenges and hurdles. And we succeeded to do it maybe twice or 3 times in several countries. We have succeeded to build such kind of a good, stable, and sustainable bridge, and to have a lot of colleagues from those countries attended to Egypt for education, training, and capacity building program, as well as sending a lot of gifts for those countries in the form of medications to support them in hepatitis B and C elimination. So again, thank you for leadership, Dr. John, as you lead this scene in a very efficient way, and we're looking forward to have a lot of such actions in order to make our life easy and to move swiftly towards our goal for hepatitis elimination in 2030. And colleagues, that 2030 is not a far target, it's very close, it's the day after tomorrow. And we need a lot to do in this very tight time period in order to achieve what we are, speak about and clearly write inside the documents and to operationalize what we are speaking about and to put these targets in its proper position and among the topmost and urgent needs in all health agendas. Allow me to build on that message from country perspective, as a lot of you may know that Egypt suffered a lot from the burden of hepatitis C. At a certain time, we were the highest country in the world in terms of prevalence. At a certain time period, almost 10% of the Egyptian populations were infected with hepatitis C, and this led to a devastating figures in terms of morbidity and mortality. But with a very good political will, scientific evidence, and public health systems, and strengthening our response and having clear national goal to eliminate hepatitis, we succeeded to be the first country to achieve the golden tier certification from the WHO, being on the path to elimination of hepatitis. And we even did not stop there, but we are continuing to do a lot of efforts to sustain this achievement and to move ahead into the full validation of hepatitis C, to get this important recognition very soon, inshallah. Through the mass screening campaigns in Egypt, which was conducted between 2018 and 2019, we succeeded to screen more than 60 million people in the age group from 12 and above, and discovered a couple of millions that we've suffered from hepatitis C, and linked them timely to care through a very swift and well-organized system that fully respect the equity, as just mentioned by Katrina, and the marginalized people, and 100% of even the marginalized people, the refugees, the immigrants, were included in that campaign as a matter of equity, and they were treated as equal as the Egyptian people, using the same medication at the same places, in something very very wonderful that happened in that way. These achievements, colleagues, were made possible by strong political leadership and a whole government approach and sustained commitment to equity, access, and long-term sustainability. And the key lesson we have learned is clear: the national success alone is not enough. If we are to reach to the 2030 targets, country achievements must translate into global political momentum. This is precisely why Egypt, together with its partner, helped to establish the United Nations Group of Friends to eliminate hepatitis, and this group of friends serves as a strategic platform to elevate hepatitis on the global political agenda. to strengthen the coordination among countries and to ensure that elimination remains a priority in the global health and development discussions. And we are very proud, as I said, that we chaired the UN Group of Friends to eliminate hepatitis for the third year consecutively, and today the barriers we face are less about knowledge. Tomorrow we will hear this very important report coming from the WHO about the existing situation and how they are looking ahead for the elimination targets. And the challenge now is more about prioritization. We have the tools, we have the evidence, and we have proven the country models. But what we need now is stronger political commitment again and more effective mechanism to translate technical success into global momentum. So, ladies and gentlemen, as we move towards our target, the role of the global advocacy platform, such as the UN Group of Friends, becomes even more critical, particularly in shaping international commitments, including the upcoming World Health Assembly process. And thanks again, John, for your efforts in pushing to have the UN high ministerial commitments and putting hepatitis in its proper place. They ensure that the hepatitis remain visible and prioritized as well. And in closing, colleagues, Egypt's journey is not about eliminating hepatitis, but also demonstrating that transformation is possible. From a high-burden country, we become a model of elimination, and from that model, we are building a global movement. And the path to elimination is clear. What remains is our collective determination to follow it. Thank you very much.